Thank you very much for being here this morning. This is a very auspicious event because the Ministry of Health over the years have been working very hard to address issues of women and all of the issues that surround the women within the context of health. And not so long ago, UNFPA and some of the other UN partners was looking at the topic of women from the perspective of survival, transformation, and to have women and girls thrive in society. The Ministry of Health took on that task by looking at all areas that focus on women and girls, from vaccination with HPV to looking at cervical cancer to looking at adolescent pregnancy, and by all means assisting with period poverty and those issues that are part of the process that comes with some of these public health issues. We have come a long way when we look at the work that has gone into women. We now have better survival rates for our women in childbirth. We have children who are girls, specifically, who are surviving the first years of childhood. And these are things that we must celebrate. But at the same time, there are a few things within the aspect of public health that needs to be addressed. And one of that has to do with sexual violence. A lot of women are victims of sexual violence, and this is one of the projects that will allow us to address this in a way that provides the results we're looking for. For far too long, we've had the system in where we did not have enough resources to be able to ensure that perpetrators are brought to justice. But this is one step closer to that. And we welcome the collaboration with the Guyana Police Force and the Justice Education Society in bringing this to the forefront and providing, and forgive me, the Canadian High Commission for supporting this project that will bring this to the forefront, that will ensure that our women and girls are safer, that they have an opportunity at education, and that just as our First Lady was speaking about standards, we want to raise the standards of healthcare services for women in our country. And this comes at a very opportune time. So with that, I now ask our colleague from the Canadian High Commission, Ms. Lisa Thompson, just to provide a brief overview on this project and how it will benefit the women of our country. Ms. Thompson.
Good morning again, Minister Anthony. It's wonderful to be collaborating with you yet again. With my colleagues from the Canadian High Commission, the Guyana Police Force, members of the press. I am very pleased to be able to share with you a little bit about our project, Improving Access to Justice for Women, Girls, and Indigenous People. It is a 4-year project funded by the Canadian High Commission and Government of Canada to the tune of $2 million Canadian dollars. It provides support across the range of areas that we need to address in order to ensure that women and girls and Indigenous people do have access to justice. So it ranges from working with the Guyana Police Force, providing training, expertise in various areas for that training, which includes, looking at their investigative skills, to what we are here for today, the provision of sexual assault evidence collection kits that will support that work of the police force and the Ministry of Health in ensuring that those resources are available, particularly in hard-to-reach communities, including Regions 1. The JEST project works in Baramita and Santa Rosa, as well as in Region 4 with the Guyana Police Force, civil society partners, and some of the key ministries. This is our first collaboration with the Ministry of Health, and for that we are very excited because it is just the first of a little piece. In addition to the provision of the test kits, we are also going to be facilitating the training in the administration of those test kits by healthcare providers. And that too is another partnership with the Guyana Police Force because their experts or who will work with us to provide that training. It's most likely going to be provided not only in Georgetown, but also in Region 1, and again through close collaboration with the police and the Ministry of Health. Additionally, we also have done work with the police, civil society partners, some government ministries, and some of our agencies, such as the Women and Gender Equality Commission, Rights of the Child Commission, etc., looking at gender and cultural sensitivity training for those persons who are not from indigenous populations but want to work with indigenous populations. I think as Guyanese, we all know that we could be a little more sensitive at times. And it's not because we want to be insensitive, but sometimes we're just not aware of how we sound, what we say, how it affects people. And so that training is focused on addressing those issues, getting people to be able to really see the humanity in everything they do. So that is it in a nutshell for Justice Education Society and its project here in Guyana. But as I said, this is a very exciting piece of work. It's been a while in the coming, and so we want to again thank Minister Anthony, Minister Hamilton, and the Guyana Police Force. And I'm saying this on behalf of course, the Canadian High Commission and Global Affairs Canada, who is here. So thank you very much.
Thank you very much, Ms. Thompson. We now hand over to the Head of Development Corporation, Mr. Adam Loy.
Thank you very much and good morning. Good morning, Minister Anthony, representatives of your ministry and representatives of our project implementing partner, Justice Education Society, and a warm welcome also and good morning to the representative of the Commissioner of Police, Mr. Clifton Hicken. I'm happy to join with Jess for this simple yet important handover ceremony to deliver on Canada's commitment to combating sexual and gender-based violence. Canada considers SGBV one of the most pervasive and egregious human rights violations, and we're fiercely committed to addressing unacceptably high rates of sexual and gender-based violence experienced by women and girls around the world. Addressing gender equality, which is directly challenged by SGBV, has been given the highest priority by the Government of Canada under the core action area of our Feminist International Assistance Policy, which we call the FIAP. And it speaks to the empowerment of women and girls so that they can live a life free from all forms of violence. Today, we're handing over approximately 3.7 million Guyana dollars worth in sexual assault evidence collection kits for use by the Ministry of Health's medical professionals. With these kits, the collection of DNA evidence from victims of sexual assault by the team members of the Ministry of Health will help ensure that the evidence collected can then be admissible in court. Through this donation, we hope to bolster the capacity of the Ministry of Health to support the Guyana Police Force in responding to cases of SGBV. It is my hope that through the awareness-raising component of this project, that instances of SGBV can be notably reduced. But in instances where they do still occur, that local agencies are equipped and trained to respond and bring to justice the perpetrators of these crimes. We understand that addressing SGBV is a complex issue, and it requires a multi-stakeholder approach. I was therefore really happy to learn that expertise in the use of these kits already resides in Guyana, and that medical professionals will be trained by the Guyana Forensic Science Lab. I would like to applaud the Ministry of Health, the Guyana Police Force, and the JEST Project for their interagency collaboration on this initiative. In closing, Canada trusts that our small donation today will contribute in a meaningful way towards combating the issue of SGBV in Guyana. With these few words, I thank you for your time and have a good day.
Okay.
We now ask our Commander for Region 4, Section C, Mr. Parsram to just give a few words on behalf of the Guyana Police Force and Mr. Hickens.
Thank you, Ms. Chairperson. Honorable Minister of Health, Dr. Anthony, representative from the Canadian High Commission, Mr. Adam Lawyer, representatives from JES, who we have been working with for over the years in the improvement of the Guyana Police Force, members of the media, all others present, pleasant good morning. I'm pleased to be here, first of all, representing Mr. Clifton Hicken, our Commissioner of Police, who is otherwise engaged. Our partnership with first of all, I must be thankful to the Canadian High Commission for their contribution over the years towards improving the services offered by the Guyana Police Force. To our partners from JES, as I said, we have been working over the years, not in terms of training alone, but they have been supporting us in gender-based violence, in terms of our investigations, in terms of equipment, and in terms of sensitizing communities across Region 1, Region 4. And by extension, we have commenced sometime late or mid last year working with the Amerindian communities, because those are some of the communities we have seen where they are very vulnerable in gender-based violence. It's a very complex and compound situation, gender-based violence, and that is why we as a force, we have been working with all our main stakeholders in our communities, trying to educate them in minimizing this harm that has been affecting society. We are very thankful for this donation today, because technology is one of the main aspects in solving crime. That is the way the world is moving. The use of technology is very important. Gone are the days where you had the forced hands-on approach of non-technology or equipment being used in crime solving. We have passed that stage. We are now using technology in most of our criminal investigations. To the Canadian High Commission, we are thankful for this timely donation. The value, as you could see, $3.7 million. This is vast support to us. We will utilize this donation in a manner to satisfy not only you, the donor, but the general public or communities, because those are the recipients of this donation, actually, not the force. We are just the partner utilizing it. We are very thankful on behalf of those communities, those who are affected. We are very thankful for this donation, and we're looking forward for future collaboration in the future. Thank you.
We now hand the mic over to the Honorable Dr. Frank Anthony, the Minister of Health, who will provide the perspective on behalf of the Ministry of Health of how we will be working with the donation from the Canadian High Commission to improve the services for women and girls in our country. Dr. Anthony?
We're very pleased to receive this donation from Canada. And in fact, we have had a very strong partnership in health with the Canadian High Commission here. And we have been working in several fields. We have currently a number of projects, one of which deals with mental health. And we've been working through an NGO, IDRF, in extending various things relating to mental health, especially training in communities and so forth. We have also had another project where we're working to train more people to manage children in neonatal care and working to extend neonatal care to many of our regions. And in addition to that, we have worked with the Canadian High Commission here through various partners to extend various types of services, including sexual and reproductive health. Canada has been very, very generous in funding many of these organizations, including UNFPA. And I think sometimes they don't get the acknowledgement because it comes through, from Canada, it goes to these organizations. And very often we see the organizations as the ones who are doing the work. But behind that, the financing actually comes from Canada. So we are grateful for this type of collaboration and cooperation with Canada. And I think what we're witnessing here this morning is another such gesture where Canada have chosen an area that is of extreme importance to us, and that is gender-based violence. It is not an area that has attracted a lot of funding, and it's not an area that sometimes people talk about. But in all societies, these things exist, and if we want to bring equity in our society, we have to tackle some of these more difficult issues. The education work that has been done, I think, would certainly help communities and women in particular to feel more empowered. But if, as Adam said, if and when cases of rape do occur, and when they come to our institutions, that we must have adequately trained medical professionals that can take the evidence and take the evidence in a format that can be acceptable in our courts of law. We don't want, because we don't have the right equipment or training, that the evidence is not taken, and then when these cases go before the court, they're dismissed because of lack of evidence. So we want to strengthen this aspect. I think these discussions have been in place for quite some time, and I'm happy that we are now at this point where we are actually receiving the kits. On the side of the Ministry of Health, we certainly would work with our professionals to make sure that they're properly trained, especially at our emergency rooms. So while this project focuses primarily on Regions 4 and 1, we would also use the opportunity to train our healthcare staff in all our emergency rooms across the country. Because I think the same modules that we'll use to train people from 1 and 4 can easily be adopted for all the regions. And therefore, they'll be properly equipped to use these kits. So once again, on behalf of the Ministry of Health, I also want to thank the Guyana Police Force. We've partnered with them on a number of things, and this is another good initiative that we'll be working on. We have also been improving the capacity of our labs, and in the near future, we'll also be working more closely with them in the area of forensics. So I think a lot of these things are coming together very nicely. So I also want to thank the force for the work that they've been doing, and we're happy to partner with them. So once again, thank you, Canada, for all the help, and we look forward to partnering with you.